Good morning, everyone, and thank you for joining us here today to gain more knowledge about today's topic. Before we go into the topic for today, here's a little about who we are. So, Mind Story is a special needs training center that provides services such as academic support, behavior therapy, clinical psychology, counseling, occupational therapy, reading therapy, as well as physiotherapy, which covers areas such as academic delays, sensory delays, developmental delays, behavioral and emotional difficulties, as well as physical delays. Okay. Do feel free to contact us if you have any concerns. Attached here will be our WhatsApp details and contact number, as well as our email address and operating hours. Do also check us out on our Facebook page at mindstory.my, our website, our Instagram, as well as our LinkedIn. Okay. Okay, so let's welcome Mr. Charlie. You're muted.
Hi, good morning, everyone. My name is Charlie. I'm a counselor for Mind Story. So today our topic, we're going to talk about planning for your child with special needs. Okay, if you join us on our last talk with Project Hans, a parent who started a website to share information about special needs, you'll hear something about you hear her journey whereby she have difficulty in terms of planning. So today we're going to talk about planning, and also we understand that there's an information gap in between looking for services, looking for diagnosis for your children. So today, based on my experience, I will also share how, as a counselor, we can help parents with children with special needs.
Okay. So before we go into that, can you share with us a little about the general guide on how to go about when planning for a child with special needs?
Yes. So normally when you hear feedback from the school, or you notice that something is your child is slightly different in terms of behavior, how they behave, or in terms of expressing, talking, communication, is slightly less expressive as compared to others, or quiet. This is the time where you can look for health professionals. Okay, and then from there, after you get the information you need, and then mostly doctors will recommend what kind of therapies or intervention suitable for your child. And then from there, then you plan forward, okay, based on the intervention plan. What you need to do first, how you go about finding all these services available. Okay. Yeah, and the most important thing is when you look for a health professional, the purpose is like killing two birds with one stone. Understand your child's condition as well as find out what the diagnosis do. Okay, because special needs is quite broad. Okay, there's four major types. Okay, the physical, emotional, social, emotional, and behavioral. You have developmental difficulties, and then you have sensory impact. So these are the four major types. Okay, so from that four major types, then you can see a lot. Like sensory impact, it can be sensory processing disorder, developmental delays, or developmental issue or difficulties can be like cerebral palsy, something have to do with neurological issues, and then you have emotional behavioral like ADHD, ODD, okay, opposition defiance disorder, ADHD, bipolar, all these under emotional behavioral. Okay, and then you have the physical, like blind, handicap, all this. So once you get to know your child belong to which group, okay, I understand that some parents are quite reluctant in a way that, once you understand or get a diagnosis, there is a label, okay, but this label, it's important in the way that it can determine the intervention, okay, the pathway for providing therapies or providing treatment for your child. Okay, so it's a doctor's job to find out, which difficulties or disorder your child belong to. If you suspect your child has one, okay, they will go through an assessment to go through it. Yeah.
Okay, so when you say we can look for doctors and specialists and stuff like that, do we go to a government hospital or a private hospital?
Very good questions. Okay, this is the question where a lot of parents ask me, but to me, all doctors are the same. Okay, it depends on, it depends on how much you want to spend in terms of like money or waiting hours. Okay, so I give you an example. If you're looking for like very specialized doctors, like developmental pediatrician, okay, they are the one that assess the child's development. Okay, they are child specialists, they are doctors, and also they are specialized in the development of a child from 0 until 12. Okay, so for this kind of doctors, there's only about 12 of them, if I'm not mistaken, in whole Malaysia. So they are both in government and private. So the waiting, the queue to wait for the doctors is almost equally the same. Okay, the only difference is in terms of payment. Okay, private, definitely you have to pay for the private fees. Government is subsidized. As a Malaysian, you only have to pay a minimal. Okay, you don't need to pay as expensive as a private, but both equally the same. All the doctors are trained. Okay, they are all approved they have to have approval or accreditation from the Malaysian government or their specific association, or they have to be recognized. Okay, and then the way they carry out, it's standardized. The assessment will be the same across, regardless in private or government. So whichever that parents are comfortable with, you can either go private or you can even go government. Okay, it's not like government is better, or it's not like private is better than government, or government is equally this. You are looking for doctors. Okay, so the traffic definitely gonna be high. Okay, like this, for example, the one that I share with you, developmental pediatrician, the queue is definitely gonna be long. Okay, the whole Malaysia, we have about 20 millions and above population, and you only have 12 doctors. So definitely the queues is gonna be long. Okay, it's not about, like, private is better and so on. No, it's equally the same. Okay, the services that you get from the government and the private, it will be the same because the standard of procedure is the same.
So like,
so that's why sometimes I share with parents, if you are convenient to go, please go ahead. If you're convenient to go government, please go ahead, because the most important thing is, after seeing the doctors, we want to see what is the intervention recommended by the doctor. That's the important part. Okay, so sometimes, like I shared just now, some parents doesn't like the idea of you have a label. Okay, we cannot avoid the label, but we can magnify the intervention plan. Okay, because doctors got a diagnosis, they have a recommended intervention. This intervention is what we want to focus on.
So there's no difference basically. It's just more of like, the waiting period that is a bit longer, or is both of it the waiting period is.
If you said doctors wise, okay, sometimes there's a high traffic because government hospital, they have limited doctors, and then you have a lot of patients a day as compared to private. So sometimes your appointment is 8, it can be 9 before you can see the doctors because the traffic is very, very high. And then definitely because in private, some parents, it's convenient and they have longer time. Okay, let's say 30 minutes or so. But in government, due to the high traffic, the doctor may be able to see see you about 10-15 minutes. It's all depending on your individual experiences. Different people have different, but I recommended parents to try it instead of like listening to some other people like, wow, government is, you know, so and so, private is so and so. But the most important thing is we're doing this, you have to experience yourself to understand how the procedure is.
So are like the specialists that works with the children the same as the ones that works with adults, like adults with special needs and stuff like that?
Okay, that's a good question also. This is where we have a lot of question about this. So there's a different type of doctors. Okay, we start with the basic one, which is the GP, general practitioners. Okay, this is, they don't have any specialization. They might have special interest, or they might have experience dealing with a particular group of community. Okay, like some parents that I met, they have family doctors who have been seeing their child for years, okay, or been seeing other child for many years. Then if you're not sure which specialist to go, you can always go to a GP and ask them. Okay, same goes to government. You go clinic kesihatan, the first one you will see is the medical assistant or the nurse. They'll ask you some question, and then only you see a medical officer. Medical officer is also like a GP. And then after that, only they'll let you know, oh, I think your child has, I'm not sure, but I have seen some of the characteristic. Maybe you want to see a specialist, then they will refer. Okay, same goes to GP. Okay, for GP, if they see something, they're not sure, but there's a slight characteristic, they will suggest to parents, why not you go and see such a specialist? Okay, and you can proceed. Okay, so some of the parents, okay, if you have existing pediatrician, or let's say your child still having a frequent visit for a checkup, okay, this is probably about 0 to 3 or 4 years old, you still have frequent visit like once a year or once in 2 years with your pediatrician. Then if you suspect, especially now after MCO, okay, you can always ask them like, okay, I might see my child has maybe different difficulty in expressing. So what should I do? You can ask the pediatrician. Okay, so that's where they also, if the pediatrician is a doctor specialized in children, okay, but that doesn't mean they are able to identify if the child has some sort of special needs, unless those very obvious. Okay, unless like cerebral palsy when you're born, then you can almost immediately see, or Down syndrome. Okay, something like learning difficulties, ADHD, you don't see straight away. So you have to find someone who are expert in it. Okay, so in terms of children and adults, okay, they have different type. Normally you see something like pediatrician. Pediatrician in general is doctors that are specialized in children. Okay, so that's why you have like developmental pediatrician, you have heart specialist for pediatrician, cardio pediatrician, you have eye specialist, eye surgeon, ophthalmologist, pediatrician. So they have something, they have the scientific name in the front, or more specific specialization, and then they put the pediatrician either in the front or the back. Okay, so this is where, in general, these are the doctors for children. Okay, so like just now I shared with you, we're gonna dive in slightly deeper. Okay, we talk about developmental pediatrician. Okay, these are the child specialists who are specialized in identifying developmental and behavioral differences, as well as emotional. Okay, they will do assessment on based on their specific area of study or area of specialization. Okay, they are able to identify disabilities or difficulties like cerebral palsy, autism, learning disorder like dyslexia and whatnot. Okay, so this is where in terms of physical or medical health that impact on their development. Okay, this is where doctors will come. This is where this particular doctor, developmental pediatrician, they come in and they can see, is there a gap in your child's development? So if let's say the gap in terms of this expressive or language skills, there's a gap. Like supposingly your child is 3 years old, but your child is not expressing like a 3 years old, then they will let the parents know. I think based on my observation and assessment, there is a slight delay. Okay, so if it's confirmed based on their standardized assessment, they will put this child has a speech delay. So the diagnosis is, it can be diagnosis and then prognosis. You normally hear this, it's like an intervention plan. Okay, so what you're gonna do, what you're gonna carry out, normally this is the doctor's term, but we always look at the recommendation. So let's say the doctor say, oh, I suspect your child, and then based on my assessment, it met the criteria of speech delay. So that's where parents don't like the label, some, not all. Okay, but the most important thing is after they diagnose, like they say speech delay, then they will say, I think you might wanna, they will recommend you to see a speech and language pathologist to do a more thorough or more detailed assessment. Okay, then from there, then okay, my next step, okay, is to find a speech and language pathology. Okay, because why doctors say that there's a gap, but a speech and language therapy can identify what's the root cause. Can it be speech difficulty or language difficulty or both? Okay, so that's why we go towards there. So so this is one way of, this is like the beginning phase of planning. Okay, talking to the doctors, going around, and nowadays we can Google search, but there's no limit in Google. Sometimes parents tend to self-diagnose. Okay, so it's very dangerous. Sometimes it gives you unnecessary stress. Remember the talk we talk about caregiver stress. Sometimes we try to gain more information, but accidentally, we see too much, and then we start to wonder, oh, what if my child have this? What if my child have that? Wow, then it gives you like, keep harping on it, you keep thinking about it, and you're unable to digest the information. Is too much. Okay, and then we talk about finding evidence to counter that feeling of like stress. Okay, is to go talk to your local specialist. Okay, internet, it can be from everywhere in the world, but does it comply to our society? We don't know. So that's why we are looking for someone who are specialized. So always go to a doctor. So the first step is I would recommend see a doctor. A lot of parents also ask me, why the first thing I see, I have to talk to a doctor first. Okay, why? Because we want to rule out medical condition. Any physical health, we want to rule out. There is no underlying factors. There's no cause from your medical condition. Okay, then that's where the doctor will move. Okay, like let's say the doctor checked that, the development of the mouth structure, the tongue is okay for the child, but the child still unable to express. So they can rule out, oh, there's nothing got to do with, other medical condition, maybe like diabetes and whatnot. Then they rule out it's not because of that. Then they'll refer you to speech. A speech and language pathologist then will go in depth, okay, to identify, is it a speech difficulty or language difficulty, processing difficulty and whatnot. Okay, this is where they'll do the assessment. As for adult, if we talk about currently in Malaysia, doctor-wise, who can diagnose disability or special needs, the next, okay, they work hand in hand. The one that we talk about is developmental pediatrician. The other one is child and adolescent psychiatrist. Okay, so child and adolescent, If it's adult, then it's a psychiatrist.
Mhm.
So child and adolescent, so they see the child from 0 and it can be until 16 or 17, the adolescent stage. Okay, for your information, in Malaysia, if your child, let's say you go to a government hospital, let's say your child 12th birthday is today,
Mhm.
12 o'clock strike, your child is no longer under pediatric care.
Mm.
It will move to adolescent. It will move to pediatrician no longer can see you. Yeah, this is where you have to look for a psychiatrist. Okay, a psychiatrist also they are trained in identifying special needs. Okay, not all but certain.
Mhm.
Okay, so like ADHD, autism, they also can identify. They have the assessment for that. Okay, so a lot of parents that that I've encountered after the child turned 12, it's like, where to go? I cannot see my pediatrician anymore. Yes, because that's the limit of a pediatrician. Okay, and then so when they transition in government or private, from pediatrician, they'll transition to psychiatric department. From pediatric department, they will move to psychiatric department.
Mhm.
Okay, but also one thing that sometimes I found parents find it quite reluctant, okay, to approach a psychiatrist because of the stigma. Psychiatrist name. When the moment you hear psychiatrist, what's the first thing in your head, Alisa?
Normal, I need help.
Okay, that's good. Some people, even for me, first time when I first started my degree in psychology, the first thing I thought of psychology or something related to psychiatric, I'll be like, oh, crazy people, the brain cannot function or something like that. So that's why, this was many years ago, and until now, the stigma is still there. At the moment, not all, but some. You talk about psychiatrists, you talk about psychologists, this is the first. Is it the one you see in the movie? They lie down, they talk to you, and then they write things, and then they do the clock tick tock like that. So these are the things that people hear about, and then they see very aggressive behavior. People got locked up in hospital or asylum. They banging on the door, they banging on the wall. So this is the things that when I encounter parents, they were shocked. Hey, how come I see a developmental pediatrician or pediatrician? Now I have to go to see a psychiatrist, because in so far in Malaysia, maybe they are, but I have not met yet developmental doctors that for adult or adolescent. Okay, maybe I have yet to find one, but I haven't encountered one so far. So normally, my understanding, working closely with doctors is after 12, the follow-up will be psychiatrist. So child and adolescent psychiatrists, they are specialized in emotional, treating behavioral and thought disorders. Okay, something have to do with your behavior, emotional, like the one that I shared is now ADHD. So yeah. So some of these things can be complicated. Okay, the medical world is not easy to understand. So it's better to ask doctor. There is an argument, for your information, that special needs, some believe that it's mental health, some is not.
Mhm.
For me, I can't really explain this because I'm not a doctor, but from what I see, based on the 4 category that I shared with you just now. So let's say we talk about specifically, what do you call this? Emotional and behavioral difficulties. Okay, even doctors from not from psychiatry can deal with, but this is the area of a psychiatrist specialized in. Okay, but it overlays. So what I can share with parents is, don't worry, you have different doctors, they overlay with each other, they work together. Okay, another example is like developmental difficulties. When you talk about brain and whatnot, you have a developmental pediatrician, you have a neurologist pediatrician, okay, who are specialized in brain. So it becomes an area where anything related to the brain, you have few different types of doctors working on it. So yeah, this is where they talk about, special needs is not a mental health issue and whatnot. But for me, how I explain to parents is I do not have that answer. I'm not a doctor, but I see it as a multiple disciplinary team. You have different type of doctors treating the same issue, okay, the same difficulty the child experienced. But that's all I can say. I cannot say that, oh, it's definitely, because I'm from the mental health background, but I don't see it as very mental health, like unless something like related to emotional and behavioral. But other than that, we see it in a way that you have different types of doctors working together. Okay, because it's fall under one category, let's say brain. You have definitely different doctors. So back to the period, child and adolescent psychiatrist, you can find this in Malaysia. You just search child and adolescent psychiatrist in Malaysia. Okay, the numbers also not very high, but it's definitely more than developmental pediatrician. Okay, so this is where they are specialized in diagnosing and treating behavioral and thoughts disorder. The common one we can hear is adolescent depression, anxiety, and whatnot. But they also the reason why we go psychiatrists also we want to find. Okay, let me share you a case. A child 9 years old was diagnosed with depression and anxiety disorder. So once the doctor did an assessment, they found out that one of the main factor that lead to this depression anxiety is because the child has difficulty in coping due to ADHD. So you can see how in-depth doctors go. So the bottom part we cannot see, but the child is presenting anxiety and depression. Okay, when the psychiatrists go deep, they found out that okay, so because of this, they have this, or they coexist, or they call it comorbid together, but the characteristic of this depression anxiety prevalence is higher, is more than this. It can be together or it can be caused by one thing. So this is where a specialist like psychiatrist can or able to dive in and explain to us. Okay, because it's related to emotional and behavioral. Okay, and then they, like I said, biological and psychological factors together. Okay, and then they can identify this is a biological cause and this is a psychological cause. Okay, and how they work together, or how they impact, or how they affect a child's behavior or emotion. And then from there, they can create a treatment plan. Okay, and also it can sometimes include medication to help or control certain behavior and thoughts. Okay, like child, we don't see that often, but the number of depression around, I would say around 10 years old, or let's say 10 years old towards 18, the number is getting higher. I wouldn't say a lot, but the number is rising. So this is where sometimes if it becomes severe, you require medication. Okay. When we talk about medication, parents have their concern. I understand. So same goes to headache. Headache 1 or 2, it can stand the pain. Maybe you do other things to relieve the pain. But when you reach the migraine level, that's where you require like Panadol to relieve. Sorry, So yeah, this is the things that where I want parents to understand. Okay, ask the doctors or ask the psychiatrists how the medication can help. It's part of the what do you call this? it's better to ask them, they ask for clarification, okay? Yeah, so this is where it's better to ask and gain information. This is the first stage lah. We talk about the specialists, who are they, where are they working from, and for adult, it's psychiatrists. Okay, they are specialized in mental health disorders. Okay, some of the things that you might hear, they do psychological or psychiatric evaluation. Okay, same like the one that I show you the speech. So let's say this particular what do you call this psychiatrist child and adolescent. Let's say they identify that, oh, your child might have some difficulty in learning. Let's do an IQ test. Then they will refer to clinical psychologists. They don't do IQ tests, they will refer you to a clinical psychologist to carry out IQ tests so that they can understand how the child is like. Okay, same goes to the developmental pediatrician. They can check like, oh, nothing wrong with the mouth and whatnot. Let's go the next stage, find a language and speech pathologist to find out what is going on with the language. So same goes to psychiatrists. If they suspect or something have to do with IQ or whatnot, both actually, then they can refer you to find a clinical psychologist to further carry out assessment. Okay. So this is where you can ask the doctor as well, why do I need this? Is it important? Okay. So for adult, you can see a lot of other cases like bipolar, ADD or ADHD. Okay, the difference with ADD and ADHD is hyperactivity is no longer there. So it becomes attention deficit disorder instead of attention deficit hyperactivity disorder. Okay.
Just now, this one part where you said that it's not good to self-diagnose, right? So for example, just say if like a child is struggling with writing and I notice that. So do I come up with a conclusion that, okay, do I straight away seek an OT or do I still go through the process of going to a hospital, getting diagnosed?
It will be the same, okay, in terms of diagnosis, it will be the same, you go private or you go for a government, but it's just that the time, depending on how fast they generate the report.
So it's important to go back to getting a diagnosis instead of straight away looking for an OT, is it?
Correct. So for government, normally they don't give you like a full piece of report. Okay, but what I recommend sometimes is parents bring a notepad, go and write, and then ask the doctor or ask the administration, if I want to get this report, how do I get it? Because there is a procedure on getting the report. Okay, it's very different from private. Okay, but either way, the recommendation will almost be the same. Okay, so let's say the doctor is a stage by stage. Okay, so let's say like the one that you say OT, right? For example, I cannot go straight unless the doctor say you can try, but we also suggest unless like in my story, unless we can identify the child has very obvious sensory difficulties, okay, then we only do sensory to find out what's the difficulty. That's the OT part of the job. Yeah, doctors do that too. If they sense that the child has sensory issue, okay, one of the senses can be hyperactive or hypoactive. This is where they will say, oh, you might want to go and OT and check. Or fine motor skill, gross motor skill is not properly developed. Then you can, then they will go and find OT.
So what about psychologists? Are there like different types of psychologists?
Yes. For as a psychologist wise, there's different type. Okay, there's a few types that we're going to talk about today. Like the number one is the clinical psychologist. Okay, this is the most common or widely known psychologist. Okay, so for psychologists wise, in overseas, you have clinical pediatric psychologists or pediatric clinical psychologists or child psychologists. But in Malaysia, so far as I know, the accredited or the one that can practice legally or professionally, legally not too sure, but professionally registered with an association is clinical psychologist. So if you're not sure if your clinical psychologist is registered or practice professionally under an association, you can just go and click MSCP, Malaysian Society of Clinical Psychologists, and to see if the person that you're seeing is properly registered. Okay, so for clinical psychologists, there is no, like in overseas, you can see like children and adult, but here you can see the experience of the clinical psychologist. If majority they see is the children, then you can ask them first, okay, I have a child with this condition, I suspect something wrong. Okay, then you can, if they say, okay, I have experience with children, then you can proceed. Same goes to if the doctor recommended, oh, you need to look for a clinical psychologist who knows about children. Okay, then you can pop into Google and start looking. Or by any chance the doctors know that someone is able to do it, then they'll recommend you to go to this center or this clinic to carry out. So basically, clinical psychologists, what they do is they also develop mental health intervention. Children with difficulty like low self-esteem, depression, anxiety, loneliness. Okay, they also provide assessment for autism, ADHD. Okay, they also do, this is an example of assessment, clinical consultation, okay, to understand your child. They also provide positive behavioral support, therapy like psychotherapy or talk therapy, and facilitate for family support, also as well as working with other professionals, okay, like OT, occupational therapist, speech and language pathologist, psychiatrists. They work with different counselor, okay, to come up with an intervention plan. Okay, the next one will be, they also able to, like I said, some of the example of special needs is autism, Asperger's, ADHD, some of the psychological conditions like selective mutism, they are able to diagnose. Okay, and then they also do cognitive assessment. This is the one that I told you about. Okay, when some of the doctors identify that maybe the child has some cognitive abilities, or they want to see the intellectual abilities of a child, that's where they'll refer to a clinical psychologist and they will carry out some assessment. Okay, one of them is like WISC. Okay, this is Wechsler Intelligence Scale for Children. Okay, it's an assessment to test the IQ test for children. And then the next one, you have clinical psychologists, we talk about it, and then we have educational psychologists. Okay, educational psychologists, if in overseas, you can see this in school setting. Okay, hence the name educational psychologists. So what they do is they are able to identify not only for special needs, but other children who have difficulties in learning in school setting. So they carry out assessment very much closely to educational setting. So in Malaysia, we still can see a number of them, but at the moment, they do in Malaysia setting, mostly they do is they provide educational testing. They work with teachers, like the setup of the school. I know some of the government sectors, they have it, Ministry of Education. They work with educational psychologists in terms of designing or come up an assessment, okay, to not assessment, come up with an idea how to improve educational setting, okay, but not diagnosis. As far as I know, in Malaysian context, in Malaysia here, they don't really carry out assessment or diagnosis, okay. Normally, like I said, they also study children of all ages and how they learn. Okay, so this is like I said, they are trained to identify, if this child have difficulty with study or learning. So yeah, and then they analyze how children. Sorry, a bit early in the morning. My thoughts are not as smooth. Apologize for the delay. Okay, and then also they analyze how children process his or her emotional, social, and cognitive. So in an educational setting, you can see they can see the children how they behave or how they interact with other children. Okay, and how they interact with the setting in terms of classroom setting. Is the light too bright, or is the kid sitting too far away, or maybe when it comes to learning, when it comes to learning, the child is more of visual or auditory, this kind of thing. Okay, it's quite well known in overseas, but here in terms of Malaysia, we have limited numbers. Okay, normally you can see for the overseas, I mean, for in terms of Malaysian context, I normally see them working a lot, like I said, government sectors, hospital, as well as university. Okay, they do a lot of educational studies, and then they collaborate with special needs teacher to develop and design special instructional learning strategies. For example, like the one I shared, the child can be auditory type of learning or vision type of learning. Okay, so this is all depending on the child. And then also materials, some materials is not suitable for the child. Okay, and then in terms of learning tools to meet the educational needs of children with special needs, as well as normal child. Let's say a child is not diagnosed, but he still have difficulties in terms of following instruction. So this is where educational psychologists come in. They work with the class teacher to find out how to improve this kind of situation. So basically, that's a general idea of educational psychologists. Okay, another one, the one that we can commonly hear or I have heard from parents, okay, is developmental psychologist. Okay, developmental psychologist is almost similar in a way with developmental pediatrician, is that they study the developmental, but this one is quite broad. Developmental psychologists, they develop treatment plan based on the child's development, but they don't do diagnosis. Okay, in overseas, they work closely to provide assessment, but not really diagnosis. Okay, they observe the developmental problems of the children with or without special needs, and then recommend the appropriate prevention and intervention to the problem. So they go age by age. Okay, even here, I myself, I'm still learning as well from developmental psychologists, because it's not something that we always encounter unless unless you have certain area that related to developmental psychologists, then you can approach them, because they work on theories. Okay, they apply developmental psychologist theories to help the children. Okay, some of the things like Vygotsky theory, you can Google and search and see what they do. So basically, these are the three common psychologists that so far I have parents.
I see. So I honestly haven't heard about the other two. I only know of clinical psychology, so it is very new to me also. Other than that, are there any types of intervention, or how many types of intervention are there?
Okay, so in terms of, before that, the reason why I put doctors first and clinical psychologists first is like I always mention, for doctors, normally we normally, because the reason why, because they can identify any medical condition. We want to rule out that first, okay? And then also we want to identify other medical, other related issue. Okay, then only we go for clinical psychologists. Some of the parents will approach clinical psychologists first, and then they go for doctors. Okay, but it's up to them. Parents have the choice to choose. But what I always recommend is to see a doctor first, then only clinical psychologist. Okay, either way, you can work either way. Both, if you want to find out more about your like autism and whatnot, both doctors and clinical psychologists, they have the knowledge to do it. Okay. It's just that when come to rule out medical condition, clinical psychologists only focus on the psychology part, psychological factors. But psychiatrists are able to see the psychological factors as well as the biological factors. Okay, so in terms of intervention, okay, this is a very famous topic. Okay, let me see. Yep. Also, types, this is number 2. Okay, the first one we talk about who are the doctors that we go to, not the general doctors. Okay, so we don't want to dive in too deep. Just basically the first person that you want to approach or you want to talk to. And also to gain more information. Okay, sorry, I have a phone call. Okay, so yeah. There's different type of therapy. Like I said, intervention in terms of therapy, this is all up to the doctors. Okay, like just now you pick up a good example where about OT. Okay, occupational therapy where some parents like they go straight to OT before seeing doctors. Okay, this is the parents' choice, but it's important to know what you're looking for. So this is where we talk about intervention. Okay, so in terms of intervention, there's a lot. Okay, there's different types of therapy available nowadays. The common one you will see is behavioral therapy. Okay, this is for child and adult. Okay, what they do is the common one that you see working with children with autism is ABA, applied behavior analysis. This is for autism. It typically includes in EIP or early intervention program. Okay, this is to tackle the difficulties in behavior. Okay, what they do in behavioral therapy is they do behavioral modification. So they promote a positive behavior or wanted behavior, and then they reduce negative behavior or behavior that is not very healthy. Okay, and then they work closely with early intervention program for children with autism. Okay, one of the, because in the ABA component or applied behavior analysis, they have school readiness. Okay, so the child starts as young as 2 or 3 years old, and then they shape the behavior. They do functional behavior, they do functional communication and whatnot. Okay, so this is the first therapy that we hear. So it's very straightforward behavior therapy. So it really focus much on behavior, but nowadays they also include like functional talking, expressing. Okay, if the doctor say, oh, you might want to see a behavior therapist, so this is where you can search this different type, a lot different type, but the one that commonly found in Malaysia is ABA type of therapy. Okay, the second one, okay, like the one that I shared, you have speech therapy. Okay, speech therapists, but the full name is speech and language pathologists. So they carry out the therapy called speech therapies. Okay, it can be language therapy as well. Okay, so this is for therapy for speech and language disorders. Okay, so the one that initially the example that I shared with you is where a doctor like suggested you to see a speech and language therapy. Okay, and then they will refer you to see a speech and language therapist to identify if it's a difficulty in terms of language or skills. So this is where they carry out an assessment to find out if your child has language or speech disorders. Okay, so an example of, this is where I always learn from speech therapists and I share with parents. So speech disorder, it can be something like difficulty in producing words and sound. So this is where they refer as a speech disorder. As for language disorder, it refers to difficulty in understanding and putting together sentences and the ideas for communication. So it's two different things. Okay, this is where a speech pathologist will come in and assess. Okay, the next one will be physical therapy or physiotherapy. You have both. Okay, in overseas, for speech therapists and physiotherapists, they will put a pediatric words somewhere there. Okay, meaning that they cater for children. Okay, but here, like I said, when you look for a speech therapy, you can check their background. Normally, they will say that their experience in geriatric means it's elderly, pediatric means it's the child. Okay, and you have adolescents. So you can see based on their background, what area they cater their services to. Okay, so physiotherapy is the same. They book both children, adult, elderly. Okay, they help with the development. Okay, in terms of rehabilitation and improvement of movement skills, and also the muscle performance, muscle tones or tense muscle. Okay, you can see this in children with motor developmental delay or motor development delay. Okay, and also something like cerebral palsy, hypertonia, all these muscle condition. Okay, it affect the bigger muscle, like you're walking, they call it gait, GAIT, so the walking style and whatnot, sitting posture, standing posture. This is the one where they will work closely and how to improve the child posture. By sitting posture, I also learned this from a physiotherapist. When your walking posture is not correct, your sitting posture is not correct, you'll affect some part of the body. Okay, especially if your child is diagnosed with special needs, then it will the way they walk or the way they sit, it will be slightly awkward. Okay, which later will impact on, if you cannot sit properly, you feel tired, then you cannot focus in class. So you can see the change from just posture towards there. So this is the area of physiotherapists. Okay, physiotherapists work on gross motor skill. Okay, something like sitting, standing, walking. They also introduce activity to improve the child's, not only child, but the flexibility, strength, and endurance of the muscle. Okay, there's certain cases that in my story here also, we require the help of physiotherapists because sometimes we able to see some children, they skip crawling immediately to walking. And then when come to sitting down on the floor, they have difficulty, like standing up, sitting down on the floor, because the process of crawling is not there. This is where we require the help of physiotherapists to understand why. And then when they do activity and they couldn't do, okay, let's say a child at the age of 10 years old, supposedly they can do, or maybe they can walk, let's say, for example, they can walk for like 10 minutes, then only they take a break. But this particular child, we observe after they walk like every 3 minutes, it requires a small break. So this is where we require the help of a physiotherapist, like to improve the strength or the endurance of a child. Okay, very much on the muscle tone. Okay, that's physiotherapy. And then we have occupational therapy. Okay, this one a lot of parents are quite familiar with as well. Okay, occupational therapy for child and adult and also elderly. Okay, they also work with children with special needs. Okay, so what they do is they develop and improve and maintain skills like the daily living, like dressing, bathing, toileting, eating, yeah, all this, going for toilet, grooming. Okay, also they strengthen the fine motor skill like writing, cutting, shoe tying, using utensils to eat, cook. Okay, so this is the general idea of what they do. Okay, and then I know it can be confusing. Okay, why is it called occupational therapy? Okay, in general, what do they do is they help you to get back to your occupation, your original occupation. So they provide therapy, helps you to recover, go back to your original occupation. Like for example, if an adult they are working, they are in a working phase, so they will provide therapy for you to go back to your working condition. As for a child, let's say 1 or 2 years old, they have difficulty playing with others. So the OT job is to help the child to go back to playing. Let's say we talk about primary school children. Okay, the child are unable to maintain or have difficulty performing at school. Okay, one part of it, then the OT will come in to see how they can help the child to go back to the occupation, which is a student, as a student. Okay, so that's why occupation therapy. Yeah, it's quite confusing. Okay, okay. Another thing that you can hear is they do sensory integration therapy. Okay, if you talk to an OT, they will show you a pyramid of learning, okay, the stages, the development of the child of like from sensory to sensory motor to cognitive, the brain functioning, the top, which is academic learning. So from there, they will go stages in terms of sensory, something that we cannot see is senses. Okay, so for children with special needs in particular, we see OT a lot in terms of sensory difficulties, fine motor skill, and gross motor skill. Okay, the one that we always see is academic learning, writing, have difficulty writing, have difficulty holding pencil. Okay, and then in terms of cognitive, they do as well, like attention difficulty. The child cannot focus for long, for a certain amount of time. So this is where, they work to find out, is it sensory or something else is bothering the child? Okay, so they carry out sensory integration therapy. Okay, they experience like the child has difficulty tolerating or processing sensory information. Okay, this happen a lot in children with developmental difficulty, autism, attention, ADHD, anxiety disorder. Okay, normally what we learn from school is our 5 senses. Okay, our eye, vision, our smell, our taste, our hearing, and touch. These are the 5. Okay, but in OT there is 7. Okay, vestibular, balancing, and proprioception, the awareness of your body in the space. Okay, and there's even a new one, not really new, but interoception. Okay, this is the area like when you're hungry, how do your body know that you're hungry? So this is the area of OT. Okay, so that's why sometimes when parents come to us, like, why do I need OT? I don't understand. Okay, my child cannot focus on it, cannot concentrate. Why do I need OT? So it might be something have to do with the sensory. Because we are not exposed in this area, so we wouldn't know. Okay, that's why here in Mindstory also, we utilize a lot about OT to help us. Okay, so
Yeah.
That's OT. So we talk about BT, behavior therapy, speech,
So,
physiotherapy, OT. Okay, and then also we have other therapies, uh, like I said, initially medication with doctors. Okay, you have medication, you have surgery. Okay, these are all under the doctor's jurisdiction for children and adults as well. So it's an alternate therapy to manage certain symptoms of or characteristic of special needs. Okay, number one, children with cerebral palsy, they tend to have seizure. So this is the area where they require medication to help them for seizure. And then you have surgery for those who are experiencing pain in movement. Again, the doctor will let you know how to improve the child to reduce the pain. Okay, some might be lengthening the muscles that are too short or through surgery to help with growth and gait. Okay, and then you have hyperactivity, impulsivity, short attention span, distractibility, all this it can be under the area of ADHD, where we know it's so much effect on their daily functioning. Okay, so this is where therapy takes some time. Okay, and you need the help of medication to go along with therapy. Okay, so this is where you require for children who have bipolar, they have mood swings. They can be happy one moment and they can be sad on the other moment. So they require some medication help to readjust. Okay, so that the mood doesn't swing, or they call it in labile mode. You go up, down very fast. Okay, and then you might have some compulsive repetitive symptoms, okay, including like stereotype motor movement, okay, like you can see like in Parkinson and whatnot, you know, they have the tremors and things, repeated motion, okay, self-injury, okay, you have cases like, you know, the child tends to harm themselves, okay, like head banging constantly on the wall, on the floor, okay, on the any way that can cause harm to them. This is where you require, sometimes, not all the time, but talk to your doctors if you require medication or not. Okay, and then you have anxiety and social withdrawal. Okay, sometimes they need medication to help them as well. Okay, so far, any questions?
so far, no. From the chat also, there's no questions for now.
Okay, no problem. Okay, the next bit of the intervention, this is recently quite hot a topic. So a lot of parents come and ask us about what is EIP. Okay, early intervention program. This is a topic under intervention where a lot of them will be like, you know, what is it, EIP? Some of them were recommended by doctors, some of them recommended by the clinical psychologists and whatnot. So EIP, as the name is quite straightforward, early intervention program. So basically what they do is they provide services and support that are available for young children. Okay, as early as, it depends on the center that provide. It can be 1 year old, 2 years old, 1 year old, 2 years old, or it can be 3, 4. Okay, but it's early. Okay, it's 0 to 5 or 6 years old only. Okay, that children with developmental delays and disabilities and their family. Okay, and then they also provide services and support like speech. Okay, sometimes if the child has intensive therapy like OT, speech and visual, or OT and speech, they have like almost on a daily basis. It can be also considered in early intervention program, because the child start to receive intervention at a very early age, and then it's a program. Why? Because it consists of multiple different therapy. Okay, another side of early intervention, like providing support, is somewhat preparing the child for classroom setting. Okay, so for example, class like the child has difficulty following normal kindergarten. Okay, then they have this early intervention program where they teach the children in different, maybe in a shorter time, because children, especially if they have difficulty with concentration, some but not all. Let's say the kindergarten is 8 to 12. Okay, sometimes if this is too long for the children, then some of the school or centers, they provide early intervention program whereby it's a shorter version. Okay, they do similarly like what the school, they prep up the kids. Okay, some of the kids who have rigidity with the like they're quite rigid. Okay, they cannot change the schedule. Okay, so this is where they will create a program for them to follow up. Okay, to support, to help the kid to get back to their schedule, like the school schedule before they go up to a bigger class. Okay, so basically, yeah. So there's two different ways, because nowadays there's a lot of EIP in Malaysia. What I can suggest to parents is do ask the place. Okay, how do you run your EIP? Who is the one that running the EIP? What are the program inside early intervention program? So you can find. Okay, so some of them, they provide services and support like speech, OT, physio, and other type of services based on the needs of the child. Okay, they are also able to have a significant impact on a child's ability to learn new skills or overcome challenges, and can increase success in school and life. So this is what basically they do. Okay, so sometimes they need to transition from kindergarten to primary school, or in between kindergarten. So parents out there, please do, if you want to like engage in this kind of intervention, please do ask the center that you are about to engage. Okay, what do they do? Okay, and then also if the doctor say, I think your child need to do EIP, then you can ask your child, the doctor, EIP in terms of like in what sense? To increase more therapy, or to go to like a school readiness EIP. Okay, like because maybe my child cannot be in the kindergarten, so they want to find like a simpler version of kindergarten. Okay, so this is where we have to clarify with the center and the doctors. Okay, so these are talking about EIP. There is also another type of intervention that I said, class readiness. Okay, this one we've seen a lot for children transition in primary school. Okay, maybe the common difficulty they have is catching up academic. Okay, they're unable to concentrate in very big classes or medium-sized classes. 20 to 30 also cannot, and then maybe they need someone who like 15 and below. So this is the place for them to transition. Okay, preparing them before, or reintegrated back, or reintroduced back to a classroom setting. So basically they focus on preparing the child or to be ready. Because when we talk about like EIP and class readiness, it's not only about academic. There are a lot of skills they need to learn in order to be in school. Okay, social interaction, speech and language, cognitive in terms of understanding concept and learning. So these are the things that EIP or school readiness will focus on. Okay, and also some of them, if they undergo a very intensive therapy, they at a very young age, that itself can be considered as early intervention program. So even I myself sometimes got confused. What EIP? What type? There's a lot of types nowadays, especially in Malaysia. So parents, if you want to know more or understand why, ask the doctors, also ask the center, what do you do? Okay, who are the person that running? Is it a therapist or teacher? And how's the program is like? And how does it help my child, or how does it support my child? Okay, yep.
I have a question.
Yes.
so today's topic is about planning for children with special needs. So just say if a child is very young, around 2 years old or something, how do we know when is the right time to go and see a doctor?
That's a very good question. Okay, I did ask doctor about it as well. Last year, we invited guests, three doctors, in fact. One is a child and adolescent psychiatrist, two is developmental pediatrician. Okay, they all give quite a similar answer. Okay, in a way that when do you know your child need to see a doctor is when you notice something, uh, there's no changes in certain for a number of months, okay, like 2-3 months. Okay, for example, you notice that your child is not talking or not responding or not behaving like the other child, okay, same age. Okay, there's no harm in asking the doctors, go and see a doctors. Or for those parents who have more than one child, if this happened to be their second child, you can observe, oh, this, but during my first child, it's not like this, slightly different. And then let's say it's been over like 2-3 months and above, that's where it's no harm in asking or looking for a doctor. Like I said just now, you can start with the normal general practitioner, GP, and then or pediatrician that you're seeing for your child or your newborn, okay, or like your child, your late 1 or 2 years old. Okay, the other one is when it is causing difficulties or affecting their daily functioning. For example, let's say the child is 2 years old, right? They don't eat for 2 days. Yeah. So this is where, yeah, so this is where it becomes a problem, because different family, different parents, the way they define problem can be different. Okay, so the level of problem is different, but these are the sort of like rule of thumbs. Okay, and then for those parents who want to know more, we do have this month a developmental pediatrician coming over to share the red flags in child's development. Okay, so these are some of the rule of thumbs that I learned from doctors. Okay, so if you notice the changes, there's no changes, let's say like interaction, okay, 2 to 3 years. I mean, like I said, the example that you gave is 2 years old, and then there is like been stagnant, it's still not talking, okay, and then the other one is impacting on their lifestyle, okay, like for example, 2 years old, or the sudden changes, okay, he used to, or maybe the child used to like to eat noodles, and suddenly the next 6 months, there's changes in not eating noodles, not eating other thing, and only prefer sweets. It's not eating a proper diet. So this is where it will affect their health. This is where you can see a doctors as well.
So I have one more question about your previous slide. Just now, you spoke about medication. So for medication, if they start at a young age, what is like the appropriate age? Just say if they were to start with medication.
Okay, this is up to the psychiatrist to decide. Yeah, because
Is it like,
yeah,
sorry.
It's okay. So let's say the child, if you see in terms of, we give a general medical condition. Let's say the child has autoimmune, oh no, don't, this is a bit complicated. So let's say the child has inherited diabetes. Okay, I think it's a type 2, if I'm not mistaken. They have to take medication or insulin. Okay, like maybe 7 years old, 6 years old, the doctors even start introducing it. Okay, it's not like medication per se, but they require this help. Okay, to help, and then from there they change their lifestyle.
So that will be like a lifelong thing where they have to continuously take, or is that also depending on what the doctor says?
Yeah, it depending. Yeah, and also, okay, A certain thing, it can be lifelong, but certain thing cannot. But the most important thing is we are uncertain about it. Okay, we have to, that's why we have to work closely with the doctors. Okay, I give you an example. How many of us here that join us today, including you, finish your dose of antibiotic when the doctor asks you to? Okay.
I don't.
Yeah, correct. So this is the thing. So when doctors say finish antibiotic, there's a reason for it. You can ask them, why do I need to finish it? Then they'll explain to you why. You don't stop suddenly. Okay, same goes to medication. Unless the medication is somewhat affecting the child, like, okay, for example, your child is having ADHD and quite impulsive, okay? Everything they do, they have to do it immediately.
Mhm.
Okay, so when they introduce some medication to help with the impulsiveness, but then the child become sick in terms of like nauseated, like or vomit all the time, then you stop and you look at doctors. Because normally you can ask the doctors, work with the doctors closely. And then if this happen, what are the side effects? Can it be one of the things that we hear a lot, I personally hear a lot from parents is medication can be harmful to the body. Yes, because your kidney and whatnot, liver have to digest all this. And another thing is medication like for ADHD, Ritalin. Okay, some they said, oh, it can be addictive. So this is all these, please do discuss with the doctors. Okay, they are specialized in this. Okay, and then if you happen to have a pharmacist friend, okay, who study pharmacology, they specialize in medication. You can ask them like, what's the use of this medication? They might not know the condition of the person, like physical health or biological health. That's doctor. But when it comes to medication, pharmacists, hence they are named pharmacists because they study pharmacology. Okay, they are well versed in medication or the chemical inside the medication. Okay, this is how you can gain information. All right. So this question, yeah, it really depends how early or how young can introduce or how old. Okay, it really depends on the doctors, okay, psychiatrists. Okay, and one more thing also, not to scare parents, but if you see a psychiatrist, normally you might experience changes in medication, okay, and then frequent meet up, like maybe 1 month twice, or 3 months once, or 2 months once. This one is for them to monitor the medication and the child's progress. Okay, because in psychiatric studies or area of psychiatry, it's very complicated. Okay, we don't have they, as far as I know, they do not have like one medication for all. Okay, the one of the simple example is Panadol. Act as a painkiller, act as an anti-inflammatory, act as a yeah. So like headache, book, eat Panadol, no more. Okay, but psychiatric, in terms of area of psychiatry is very different. Okay, if child with a same condition, they might react differently towards the medication. So it's very important for parents to know, to learn with the psychiatrist, to know about, like, how young can my child, or how old can my child, or is it too early? From what I've seen personally, some of the cases who in long-term medication, they do provide honeymoon phase, they call, where there's a time where the child is off medication for a while and then reintroduced back. Okay, and then if the child, the doctors and the parents are satisfied with the program, satisfied with the medication that's showing improvement, then this is where they call tapering off. The doctors will work closely with the parents to taper off, slowly reduce. They will come up with a tapering, they will come up with a tapering of a schedule. Okay. and then tapering off schedule, and then they will work around how do we like finally remove. Because we wouldn't know, you've been on medication, suddenly you remove, we're not sure how the body gonna react. That's why they have this tapering and slowly tapered off medication and help to improve.
But at the same time, like medication wise, right? What if like you say you have to come in and then you have to check in with the doctor from time to time? But it's basically also like a testing period, is it? Where they see if the medication works. Is that dangerous?
Okay. Okay, if you see a doctors, they won't do something harm to you. Their job is to save people. Like I said, yes, it will be sort of like a trial and error. Okay, you can ask the doctor for clarification. Okay, because like I shared just now, there is no one medication that works. Okay, let's for example, like the one that said headache, take Panadol. Okay, fever, take Panadol. Painful, your leg painful, take Panadol. Okay, but for like depression, okay, you have antidepressant, you have different type of medication, but it's just that this is the beauty or the uniqueness of individual. Okay, individual differences, they somehow react differently. They might have the same side effect, but some will be severe, some will be not. Okay, so it really hard to say. So that's why it's very important to see a psychiatrist, and also they have a frequent meetup once a month, or twice a month, or once in 2 months, once in 3 months. They want to follow up. How is the medication doing? Okay, yeah.
Okay, so what are the types of special needs education services that are available?
Yeah, so this is a tough, quite a tough question in terms of in Malaysia. You can see a lot of therapy, but so far, like in terms of providing special needs education, it's quite a tough situation. Okay, but a common one you'll see in private practices, enrichment center, homeschooling program, okay, group or individual. Okay, but this one you have to be aware. As far as I know, Ministry of Education have like stopped the so-called homeschooling, but it can be like, I think nowadays it's called study group, or one-to-one tutoring. Okay, a special learning center. Okay, in a private center, you have private school, kindergarten, nursery, play school. Okay, sometimes they will ask parents to hire a shadow aide to follow the child, to assist the child. Okay, some kindergarten or nursery or play school or high school, secondary school or primary school, they have a department for special needs. Yeah, so that's where you can enroll your child. Then you have vocational school. Vocational school normally for, I think, secondary school, if I'm not mistaken. So you can search which area that provide academic, other than therapy-wise, that provide support on academic. And then for the government side, actually the government did a lot of initiative. Some of them is under JKM, okay, our welfare department, and then some mostly is done by Ministry of Education. Okay, you have something like program Pemulihan khas, okay, program pendidikan inklusif, PPKI, program pendidikan khas integrasi. So this is where primary school, government primary school, they have a special department for children with special needs. So they will be in the school with any other children without any special needs. So they work together. Okay, this is under the PPKI, okay, Program Pendidikan Khas Integrasi. You can check out on Ministry of Education website. You can look for schools. Okay, I think there's quite a number. There's a list for whole Malaysia. Okay, like here where my story is, Subang Jaya itself. If I'm not mistaken, there's about three school that provide PPKI. I think it's SKUSJ2, SS19, SKSS19, and one more is also near SS19. Yeah. So normally they have a plaque outside PPKI to inform anyone that this school provide education for children with special needs. Okay. The requirement can be slightly different in between private and government. So for government, it's compulsory to have the special needs card, or they call it OKU card. Okay, orang kelainan upaya, no longer orang kurang upaya, ya, it's orang kelainan upaya, which means people with different types of difficulty. Okay, so and then from there, it's a compulsory to have the OKU card to enter government school. Then, because the seats is quite limited for PPKI.
What are the difference between a private school setting for special needs kids and government?
Sorry?
What are the difference between government school settings for special needs children and also private? Is there any?
I'm not very sure myself, but one thing I know is, the classes is smaller in private. I mean, you have more control in terms of like, it really depends on the school though. Yeah, how they provide. So parents, please do and ask and experience. Okay, because I myself have yet to been into one government school, so I'm not really sure how it works. But what I know is they have teachers, okay, and go accordingly towards their needs. Okay, so let's say they have the syllabus where it's for children with special needs. Okay, but the one that I know is the obvious differences is the classroom setting. Definitely will be smaller in private school as compared to government school. Okay, so yeah, like I said, that's the latest update, if I'm not mistaken, from Ministry of Education. This is 2018 statistic. Now it's already 2022, 4 years. There's about 2,346 schools around Malaysia that provide PPKI. Okay.
What
and
are
then
some?
You have, yes?
No, it's okay, you can carry on.
And then there is a specialized team, they call it 3PK, that are also under Ministry of Education. Pusat Perkhidmatan Pendidikan Khas, 3PK. So you can receive, let's say your child having difficulty, you can call up 3PK, or you can search 3PK, set an appointment. So they have a psychologist, speech therapist, or any type of therapist available there. They can do assessment for you. And like I said, being a government organization, the fees is quite minimal as compared to private sector. Okay, and then 3PK, because there's only one unit in one state, so the appointment is quite long queue. And then you also have Sekolah Menengah Pendidikan Khas Vocational. Okay, the one that I know that has recently made a lot of headlines in Malaysia is the vocational school in Sabah, Keningau Vocational. That one, recently they have a lot of children with special needs join international competition. Okay, that's the school that they promote. Okay, and I mean, this is where they promote and do a lot of what do you call this, training. Okay, I think it's called KV, yeah, Keningau Vocational in Sabah. This is a government school, and you can search. And recently they really made a lot of headlines because a lot of children, they take in a lot of children with special needs.
Okay, we have a question from Ms. Zoya. She said, If I were to send my child to a private school that has no support for special needs, what should I do to support my child if I choose to send my child to this school?
Okay, thank you for the question. First, I'll recommend parents to ask the school first. Okay, if I want to send my child to this school, how do we work out the support? Okay, let's say the school could not provide any support, then can I bring my support in? Okay, in support in terms of it can be shadow aid, it can be different types what we call accommodation. Let's say my child will come slightly late because it takes a longer time to prepare himself, or my child have to leave early because they have therapy after that. Okay, or let's say my child is having a meltdown, or maybe it's just not my child's day. So my child is having difficulty regulating information. Is there a special room? Okay, or not really special room, but is there a space for my child to vent out? Okay, and then let's say in terms of academic, where maybe the school compulsory is 10 subjects, but my child can only take maybe 4 or 5. So how do we go about it? So when it comes to this question, it's very important to ask the school, how can we work out a support plan for my child? Okay, because this is a very good question, because some of the child, when you look at them, you don't know they have special needs until maybe in terms of academic learning, then you see, okay, especially child with learning difficulties or child with learning disabilities. Like a child, if it's diagnosed with dyslexia, they will see alphabet invertedly, or differently or opposite. Okay, 6 become 9, 9 becomes 6, B become D. But when you look at the person, you wouldn't know he or she is having difficulty. So this is a tricky part. So this is the part when we go to school or private school, we want to work around the school. How if you cannot provide, how can we as a parent provide? Can we bring our own support? Yeah. So yeah, I don't have a precise answer for that question, but this is what I can suggest. Please approach the school and work it out, like how do we support? Okay. Yeah. So like, for example, some of the schools that I know that parents encounter that share with me, the requirement, like I said, academic, the subject requirement, the school want them to take 9 subjects, but after discussion, this child only took up 5 subjects. And then the subject that he or she doesn't have, this child will be in a library to do their own reading. Okay, because this child doesn't take the subject, so not required to be in the classroom, but the school able to do some accommodation by moving him to a library or somewhere for self-learning. Okay, so it's really different from school to school, and see how they can support, or how can parent and school provide support for each other.
Okay, so
Yeah.
what are the type of...
Yeah, before that, sorry, there's one more. It's Pusat Dyslexia Malaysia. They have collaboration with government school as well. I think under PDM, Pusat Dyslexia Malaysia, you can find that some of the school, which are the schools around Malaysia that support children with dyslexia.
Okay, so what are the type of things that is needed to take into consideration when planning for a child with special needs?
Okay, so we have come to the final part of planning. After knowing your child difficulty, knowing what type of doctors, gaining as much information as possible, and then like I shared just now, the type of therapies. Okay, you can for those who join us late, you can just scroll back and listen, understand the types of therapy, the types of intervention, the types of doctors and therapists, okay, psychologists, okay. This is the thing that once you understand or get a knowledge about how about these types of intervention and whatnot, and the therapists or the professionals that work, then you know the direction. Okay. After you knowing the direction, this is the last part. Okay, but I always emphasize this when it comes to planning. Okay, things that you need to consider. Okay, number one is the biggest burden to parents with children with special needs. Okay, financial. Okay, I've been telling a lot of parents, expensive doesn't mean it's the best for your child. Okay, the most important thing is because therapy is long term. Okay, long term as in it's not very fast, like I like to use this Panadol. Okay. I'm not sponsored by Panadol, but I always use this as an example. You know, when you headache, you take Panadol, the next 5 minutes you're okay. But therapy require times. Okay, the child require times to learn, to work around. Okay, to change their lifestyle. So it takes time. Okay, so you have to be careful with the financial wise. Okay, some parents, I mean, it's their right, but what I can suggest is to be very careful with the financial wise, because it creates a high amount of stress to parents, because things nowadays are not cheap. Therapy is not cheap. Okay, so you can do a different type of way. Okay, like here in Mind Story, we do have parents who struggle for private setting, but we help to integrate them to work with the government setting. Okay, half government, half private. So for example, if they get an appointment to do OT in government, let's say the government give like one therapy fortnightly. So meaning 1 month, you only have 2 times therapy. So if you have the additional financial power, you can add 2 more from the private sector. So it becomes consistently every week you have at least 1 OT. Okay, this is how you work on it. So for those who can afford, then definitely private, you can go 4 days, okay, or intensive. Okay, there's a different way of doing it. It's not necessarily expensive, it's good or the best. Okay, it's really depend on the parents. In the end of the day, parent is the one that taking care of the child. Okay, the child wouldn't know how expensive it is. Okay, but parents know. Okay, and then you have direct financial restriction, medical fees, therapist fees, transportational fees, equipment devices you need to buy to aid your child, nutritional supplements. Okay, some of the child who are picky eater, they don't have, they might have experienced certain lack of nutrition. Okay, and then you have indirect financial restriction, household resources. What if one day my spouse stop working, then I have to pay all this together. So this is the thing that have to be included in when you come to plan for your child with special needs. Okay, and also this child that receiving therapy or treatment might not be the only child. You have, you know, other child to take care of as well. So that's number one that I always told parents: financial. Financial is very, very important. Okay. And then secondly is the logistic and transport. Okay, traveling distance, traveling from one place to hospital to therapy center. Klang Valley nowadays, the traffic is very, very bad. So this is the part where it really stresses the parents out. Okay, like I have to drop the child by 6 o'clock. I mean, sorry, 7 o'clock at school. Then I go to work. 12 o'clock, I use my lunch time to pick up my child or drop them lunch. But due to the traffic, it's very hard. Like here in Mind Story, we have parents as far as Kinchan, Nilai, you know. So this is where we recommend parents that, you know, why not we explore places around you instead of have to travel down all the way to Subang. Okay, Some of them, if they can do teletherapy, meaning online therapy, yes, we can do distant therapy, but some require physical class. That's where we have to consider the logistic transport. Like I said, therapy take time. Maybe parents can do the first 1 or 2 months driving, but after that, the following months, it will be quite hard. Okay, traveling time. The transport option. In Klang Valley, we have a lot of buses, e-hailing services. But what if we are from somewhere that is not well developed or suburban area, then it will be quite difficult in terms of transport option. So traveling time, due to the traffic, lack of parking, all this, you have to bring your child up to the center or to the hospital. It all takes time. So these are something that we have to consider. Okay, and then lastly, mental health of the caregiver or parents. Okay, this one somehow you do feel physically, emotionally, and mental exhaustion. This is something that parents have to be aware of. Okay, when it comes to planning. Okay, we are talking about marathon. This is something I always share with parents. We are not doing a sprint. We are doing a marathon run. So it's not about who reached number 1 first. It's how consistent we are and how do we prolong our commitment and motivation. Because under a lot of stress, basically a human has limited function. Okay, your function are restricted by all this stress. So we need to find a way how, when it comes to planning, to achieve a balance. Like the one that I share on the top, logistic and financial, is the top 2. Number 3 will be time. I don't have time for this. I don't have time for that. So these can contribute to stress. Okay, everyone has stress. I'm not saying that you can remove the stress totally. Everyone have stress, but the most important thing is manageable stress. Okay, you can have when a stress is at manageable level or a bite-sized level where you can control, then yeah, that will be like you will strike a balance. But if you constantly have something to worry about, concern about, which affect your health, that's where you experiencing caregiver stress, okay, or burden, okay. And then the next phase will be burnout. It will be tiring for parents, okay, or caregivers, okay. And then because of this stress, it will increase the risk of physical and mental health issue. For example, depression, anxiety, heart diseases, or any existing medical issues like diabetes, hypertension. It can increase the risk, or it can worsen the condition. Okay, and then also coping skills. If an individual does not have a very healthy coping skill, they will turn to substances. Okay, alcohol. I'm not saying that drinking is not totally good. They have their own argument, but what I'm saying is abusing it. Okay, use it as a tool to controlling your stress. Okay, stress management is not a very healthy way. Abusing, overusing prescribed and unprescribed medication like sleeping pills. Okay, these are the things that can contribute negatively to parents and the family as a whole. So that's the last part of the planning. Okay, so in general, we talk about types of doctors, okay, and types of psychologists, types of health professional, types of intervention, okay, and lastly, the planning part. After you have all the information at the top, and then please put yourself into consideration, put yourself into the equation, okay, because planning is about yourself and your child.
Yeah.
People can give as many testimonials as they can, but the most important thing is ask questions, go and experience it yourself. Okay, it might be good for some, but someone else's child, but that doesn't mean it's workable for my child. Okay, and by gaining all this information, you know the direction. Okay, priority. Okay, when doctors say, "Oh, you have to do this," that doesn't mean you have to do all. Okay, it comes to financial as well. Okay, you have to know priority. When you know certain therapy can definitely improve more, then I suggest to focus that first. Then we do one step at a time. Okay, if you have the financial capability, you want to do all, then you have to consider your time. You can pay for all the treatment, but do you have the time to practice at home? Okay, and drop off and pick up. Okay, so these are the things that we have to strike a balance.
Yeah.
So,
Okay.
any question?
Yes, there is one more question. So does this mean there are different stage or type of therapies following the child's development and age?
Yes, correct. That's why you have child and adolescent, you have adult therapy. Okay, for example, sensory. I can share you one of a very obvious sensory for children. If you've seen OT before, occupational therapy, how they work in terms of tactile, they do brushing. But as they grow older, let's say 7, 8, 9, 10 years old, brushing doesn't work anymore. So different stages have different requirement based on different therapies across. Okay, behavior therapy as well. Same goes to early intervention program. Would you put 11 years old child into early intervention program? Yeah, because it's pretty straightforward. Early intervention program. So I would not suggest, because this is the thing that it's widely available, but we have to, I'm not saying that parents, if you do something not accordingly, but don't blame yourself for it because we were not taught to do this. Okay, there's no school to teach us about parenting. There's no school to teach us about what should we do when I found out my child has difficulty or special needs. Okay, so this is all, like I said, trial and error, go and experience. Okay, and work with parent support group. Okay, and NGO, ask them as many questions as you want. When you see a doctor, ask them as many questions as you want, so you know the direction for your child. And the most important thing is, parents, you know your child the best. Okay, you can find the best therapists in the world, but they are best in terms of what they train for. That doesn't mean they are best in treating your child. Okay, so this is what we do, empowering parents to know, you know your child's strength. Before they get angry, you know some of the pattern, So this kind of thing you can share with the therapist and they can work together. Okay, parents know their child the best. They want everything the best for the child. Hence, confusing decision kicks in. Should I do this or should I do that? Should I go doctor or clinical psychologist? Because they are looking for the best. But when we are looking for the best, please consider yourself into the equation, parents, like financial, logistic, and time, and also your mental health. Okay, because in the end of the day, you are the one that taking care of the child. If you stress, if you go overboard or over limit, then take a break for yourself. It's okay to take a break for yourself and then continue the journey. Okay, remember, like I said just now, we are doing a marathon. Okay, it's not a sprint, 100-meter sprint, and it's not a competition of whose child is better or who can get number one. Okay, the ultimate goal when we plan for children with special needs is we want them to be able to work or communicate better with the community. It's not like we want, okay, having therapy, it takes time, and that doesn't mean your child can be normal again, okay? There's no cure at the moment for special needs. What we want is they are able to communicate their needs and wants instead of doing different, instead of expressing it in an inappropriate way. We want them to deliver the message in an appropriate way, okay? Yeah.
I think from these, like when you said financial, right, I kind of like also like it's a bit how do I say this?
Mm.
I feel like financial and mental health plays a big role in this whole thing. Like even when you said about the part where you said logistic and transport, like traveling and distance, if they're stuck in a jam and they already paid for therapy sessions and stuff like that, this is all the type of things that contribute to it. So just say if you're half an hour late and the session cannot be cancelled. So all of this is like more stress, more money, a lot of things contribute to each other. So it can get very stressful for parents, I would say.
Yep, definitely. Yeah. And then if once you cannot commit, you already pay for the payment of therapies, then constant cancellation. Yeah, it does create like, wow, it's so expensive. I cannot afford to miss it. I die have to go there. So yeah, this is all the additional stress for parents. Okay, and then like I said, here in my story, we even have parents from P40, but that doesn't mean they don't deserve therapy. It is a way of working around how we work around financially. Okay, government, we do the government way. You have the private, you have the mix, it's up to parents. The most important thing is we have to take into consideration about parents. If both working parents, the therapy happen to be on weekdays, how are you going to manage it? Yeah. These are the things that you have to put yourself as a family. Okay, husband, wife, and child, or husband, wife, or children. Okay, you can have more than one, but you have to consider, you have to take into consideration as a whole group. Okay, not personally like I can and you cannot. Never mind, I do it by myself. This is where spousal relationship, okay, or family relationship will be disrupted. Okay, the dynamic changes. The dynamic of the relationship between spousal and family members will change. Okay, something that I've personally seen is sibling rivalry. Okay? So I've seen cases where siblings started to feel it's not fair. Why my sibling can go therapy and have fun when I'm here sitting in a tuition center 9 to 5, all about academic, when my siblings are playing balls, have fun with the therapist. Okay, so this is where I always recommend parents, we plan as a unit, not as an individual. Okay, we have to take into consideration all of these kind of things.
Yeah. So I think there's a lot of things to digest for today, but I did find a lot of it beneficial. Like I lately I noticed also there's a lot of things that could be possible stress for parents, because like a lot of cases now that kids are getting kicked out of schools and stuff like that. So it's like they don't really know where to go. And this kind of things can also add on to stress. And what, like you said, okay, what if a school can accept the child and then we bring in additional support from our end, like the parents bring in support from our end, and shadow it and stuff like that. But what happens when the school don't want to allow that too?
Yeah.
Then
So this is where then the option is we move to another school.
yeah, that's true.
Ultimately, priority is also very important. Some parents, they want to focus on the child's development, not so much on academic. Then they go for the developmental part. Some parents, they want to have both. Then they can try both. Some parents, they want to focus more on academic, less on therapies. They can do it. But the most important thing is you know what to plan for. Where are you going to? What are you gonna encounter with? Who you gonna encounter with? What are the challenges? All this have to take into consideration. I'm not saying that we can predict barriers and challenges, but what I'm saying is be prepared for it. Okay, it is taking care of a child without special needs is gonna be tough. But when you take care of children with special needs, it will be extra tough. It will be tougher. Okay, there's a lot of caring to be done.
I personally still don't understand how come having a child with special need incurs more costs than having a typical child.
Okay, if you see it in a way that if you're having a child, definitely there will be a cost. Everything there's a cost, but how do you manage the cost? is up to you. The most important thing is don't overcost. You don't spend on something that you cannot hold for so long. Okay, yeah, you don't over budget, and then you cannot manage it.
Yeah.
So that's the most important thing. So you go according to what you can afford. But that doesn't mean you're not giving your best. It's a two different thing. I have parents who are telling me that, I don't love my child enough because I cannot give them the best. When I ask the best, it's because when I ask more, inquire more, then I realize that parents are striving for very expensive therapy. To them, expensive is good. So this is where I have to redial, bring the parents back to reality. Okay, realistically, we cannot afford. That doesn't mean it's not the best. What you have now, we can make the best out of it.
Yeah.
Okay, like today I ride bicycle. To me, it's the best thing in my life. That doesn't mean that I have to buy a car, then only it's best. It's best for someone, doesn't mean it's best for me. Yeah, so this is the most important thing. Sometimes, like I said, parents love the child, okay, and this is what they are willing to do. And because of this, a lot of centers or private sectors, they are able to, they know parents are desperate, okay. I'm not pointing fingers. I'm just saying that this in private sector is all about business, okay.
Yeah.
That's why they are in the services business, okay. But you have to know yourself well, know the direction well, so you know. Okay, going for wrong therapy, having a bad experience doesn't mean that you are a failure or blame yourself. It's part of the experience.
Yeah.
Because like I said, it's very complicated when it comes to therapies.
So I think there's a lot of guidance that's needed when it comes to planning for children, especially a lot of help that you need to seek also. So it's not just you doing everything, it's more like you seeking for help and getting the additional support that you need in order to create a plan that is beneficial for your child, right?
Yeah. The most important thing is we learn how to seek help. And in our culture, we are not taught, or in a way that we grow up, that we take everything by ourselves. Okay, but when it comes to planning for children, especially, it's best that we seek out for information, because nowadays information can obtain freely without even paying. The most important is where to find it, how to go about it.
Yeah. Okay, so before we end, is there anything else you'd like to share?
That's it from myself. I hope parents will take into consideration about themselves when it comes to planning, and then go through some of the things, some of the points that I have shared. Knowing who you're looking for, knowing where to go, knowing what to do after seeing a doctor or clinical psychologist, and knowing yourself. What can you do to work with your child? These are the in summary, the important parts, the components when it comes to planning. Yeah. So that's it for myself.
Okay, so thank you very much, Mr. Charlie. I'll see you again next time.
No problem. Thank you for having me today. All right. Bye-bye. Have a good day.